Well, it's a rapidly exploding field. We've had combination therapy with inhaled corticosteroid and long-acting beta agonists for about 15 years now. Just in September of this year, tiotropium, a long-acting antimuscarinic, was approved for asthma. We've had omalizumab, a biologic product that could be used for asthma, for 12 years. And this Wednesday of this week, the first anti-IL-5 was approved. So we are beginning to have more intervention strategies to help these patients who have very high burden of disease. And we have to figure out who to hit with the big hammers we have now. We have to look at the clinical presentation, the phenotypic expression, and also the endotypic expression of disease, which is basically the biologic markers that drive their airway inflammatory pattern. And there is overlap between the populations, and one size doesn't fit all. And so we're still trying to find our way through the morass to figure out which drug is right for the right patient. And for an individual patient, both of the biologics may be adequate or appropriate interventions. Block a different inflammatory pathway driven by interleukin-5, which is a major stimulant to attract eosinophils into the airway, which are part of the driving mechanism for persistent airway inflammation in a subset of patients with asthma. What allows us to address patients with high burdens of disease, with frequent exacerbations, who are not being controlled with the current therapies that we can send someone to the retail pharmacy to obtain. For a subset of patients who have non-allergic asthma, in quotes, have different inflammatory patterns primarily driven by neutrophils or by other cytokines that don't leave a footprint in the airway that we can measure easily, they're basically steroid resistant. And so the usual drugs, in quotes, that we use, well, may be ineffective in up to 30% of patients with asthma. Children tend to have a more pristine response because they tend to have a more robust, allergically driven airway inflammatory pattern and tend to respond better to even low-dose inhaled steroid with or without a long-acting bronchodilator. Clearly, there are groups of children, and I've been involved in a study called the Tenor Study, where we reported over 1,200 of these children have been following now. We collected the data 15 years ago, and we just have a follow-up, actually, presentation at this meeting about that group. And they still have a very high burden of disease 15 years after they were enrolled in the initial study. Back in the early 80s, Dr. Tom Platts-Mills, who's the chief of allergy at University of Virginia in Charlottesville, said that TB was the biggest problem with the asthma epidemic. Patients were inside, they were becoming higher BMI, less active, exposed to more indoor allergens, and not outside, getting exercise and staying fit. Happens that Tom was right, and the time now that, of course, the TV has been replaced by the computer, but the idea is still the same. We have to talk about the appropriate pharmacologic and non-pharmacologic treatments for asthma. And the non-pharmacologic treatments include avoiding indoor allergens, avoiding smoke, environmental tobacco smoke, either passive or active smoking, avoiding highly polluted areas, and trying to avoid infection as much as possible. Asthma in its milder forms can very effectively be handled by primary care practitioners. As patients begin to become more symptomatic, if they have an allergic cause that needs immunomodulation, either with allergy immunotherapy or one of the biologics, then of course referral is important. And patients who have a high burden of disease, who are not responding to low-dose inhaled steroid or low-dose inhaled steroid and a long-acting bronchodilator, then I think it's appropriate at least to have a consultation with an asthma specialist. Well, the problem is asthma is not one disease. Asthma is a syndrome, and it's basically a compilation of many different endotypic expressions of this syndrome, and one size doesn't fit all, and we're clearly not there to take care of everybody effectively.